I want to talk today about the thousands and thousands of failed medical theories over the centuries and the millennia, and wind up speaking about details of the top 4 or 5 of them of the 20th century. And I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Epigenetics, The Death of the Genetic Theory of Disease Transmission. And this is going to be an awakening for you. And when you look back thousands of years ago, they thought, of course, that disease were caused by evil spirits. And then they thought it was caused by little guys, gods sitting up on planets and determining what goes on in your life, including disease and death and so on. And then there was the theory of spontaneous generation. It just happened. And then, of course, there were the 4 humors: blood, yellow bile, black bile, and phlegm. And if they got out of balance, they'd use bloodletting, either with leeches or just cut you and bleed you and hope to balance up those things. But in the 20th century, there were thousands and thousands of failed medical theories, but the big ones were, of course, cholesterol and saturated fat. The theory was that they caused plugged arteries and heart attacks and strokes. It's absolutely not true. There's nothing more further from the truth. Cholesterol is an essential nutrient, and saturated fat is not bad unless you fry in it. And physicians created diseases by getting people on low cholesterol diets. Alzheimer's disease is a cholesterol deficiency. Okay, it's not a genetic thing whatsoever. It's a multiple nutritional deficiency. The major thing that's deficient is cholesterol. Okay, makes up the major part of your brain, the part of your brain that goes away when you have Alzheimer's disease. Oh, yeah, it also makes up 95% of testosterone, estrogen, progesterone, and adrenal hormones, because these are steroid hormones. And cholesterol makes up 95% of these hormones. And so if you're on a cholesterol-restricted diet, you're on a cholesterol-lowering drug, a statin drug, there's nobody home. You have low T. You're going to have erectile dysfunction. Oh, don't worry about it. They got Viagra. And then, of course, salt doesn't cause high blood pressure. Salt has 2 essential nutrients, sodium and potassium. But doctors say, remember, they only live to be 56. And then, of course, you have things like, how about... what about this disease of the cow's brain, right? Mad cow disease. In humans, it's called Creutzfeldt-Jakob disease. They want you to think that it's caused by prions, these proteins that are infectious. Well, they've injected it thousands of times into cows that were normal, couldn't produce mad cow disease. They've taken Creutzfeldt-Jakob disease brains from people who died from that and injected into primates, including chimpanzees and monkeys, couldn't produce it. They haven't satisfied what was called Koch's postulates, and as a result, guess what? It's not a genetic disease. It goes back to a disease that was discovered in sheep back in the 1860s. It's called enzootic ataxia. Looked just like mad cow disease in cows, but when you look at it under the microscope, it's exactly the same. It's actually caused by a deficiency of copper. And then, of course, you have genetics. Genetics, that was the big one. Trillions of dollars spent. The genome mapped out. I mean, people got Nobel Prizes all over the place for the genetic theory. Well, it turns out there's not a single birth defect that's caused by genetics. All birth defects are caused by nutritional deficiencies of the embryo. You can have everybody in your family have heart defects, and then that next generation, they supplement properly prior to conception, all through the pregnancy, the baby's development, and all the babies are going to be born normal without a heart defect. Okay? All birth defects, I'm going out and saying it just as clear as I can, all birth defects are caused by a nutritional deficiency of the embryo. So I want you to say, we can have a whole family, 6, 8, 10, 12 generations of our family, disease-free. Our children will all be perfect. Nobody has to sit home with disabled children. Our insurance rates will be extremely low because nobody's sick. And you all get all the information in the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. There's not a genetic disease, okay? For instance, heart disease is not genetic. Alzheimer's disease is not genetic. Things like arthritis is not genetic. High blood pressure is not genetic. Sickle cell anemia is not genetic. Sickle cell anemia, thalassemia, things like type 1 diabetes, PKU. These are all what we call inborn errors in metabolism, where the mother, during pregnancy, was missing things when the parts of the bone marrow, for instance, were forming that made hemoglobin. And so they don't make perfect hemoglobin. And for type 1 diabetes, the parts of the islets of Langerhans, the beta cells that actually make insulin aren't there because mom was missing something when those cells were forming. And so you get type 1 diabetes. None of that is genetic. Type 2 diabetes is not genetic. We've known for 70 years that's a deficiency of a single mineral. In the history of all these false and failed medical theories, I mean in great detail, including my cystic fibrosis and muscular dystrophy stuff, shows very clearly that cystic fibrosis and muscular dystrophy are just simple mineral deficiencies, have nothing to do with genetics. And, of course, the Cystic Fibrosis Foundation should have stepped up to the plate. They didn't. Emory University and Yerkes Primate Center fired me for saying it wasn't genetic. And then we gave the information on muscular dystrophy to Jerry Lewis, and the Muscular Dystrophy Foundation fired Jerry Lewis. So these were Jerry's kids. He raised billions of dollars for them over a 22-year period. And they fired Jerry Lewis when he came to them with our information saying that we believe we knew the cause, prevention, and cure of muscular dystrophy. They should have said, okay, well, here's 10 tough kids. Some of them will be 3 days old, some will be 3 months old, some will be 3 years old, some will be 12 years old, some will be 20 years old. Let's see what we can do with them. Well, we know how to get rid of genetic markers because it's not genetic. Epigenetics, the death of the genetic theory of disease transmission. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, it's happened again. Remember, there was a case in Vegas a few years ago where people were using some sort of medical equipment that wasn't being cleaned properly, and a whole bunch of people got infected and died. Well, it's happened now in Seattle. Headline of this CNN story reads, "Superbug spread through contaminated scopes sickened dozens in Seattle." So a drug-resistant superbug infected 32 people in Seattle over a 2-year period. The bacteria spread through contaminated medical scopes that had been cleaned to the manufacturer's recommendations. Also, a little later in the story, they say those recommendations were approved by the FDA. FDA put out a statement that says they're actively engaged with the manufacturers and other government agents to develop solutions to minimize patient risk. And this happened at the Virginia Mason Medical Center, and 11 patients were infected between 2012 and 2014. Or actually, there were 32 that were infected, and 11 of those patients eventually died. A little farther in the article, they say, but those patients were critically ill before being infected, so it's unclear what role the bacteria played in their deaths. Well, if you're already critically ill and then they give you a superbug, you don't think that's going to kind of kick the can down the road a little farther? And they say these patients were infected with a drug-resistant bacteria, including a rare carbapenem-resistant enterobacteria, and they say which is difficult to treat because they have high levels of resistance to antibiotics, according to Dr. Jeffrey Dunn, a senior official at the Public Health Seattle and King County. They say that this follows similar incidents in Pittsburgh in 2012 and Chicago in 2014. Contaminated endoscopes infected dozens of patients, according to health officials. In the Seattle case, they say public health officials said the germs apparently spread from patient to patient by endoscopes used to treat liver and pancreatic illnesses. The scopes are typically used for thousands of procedures each year. The scopes at Virginia Mason Medical Center were sterilized to existing standards before use, according to Virginia Mason Medical Center. In a statement, they say this is a national problem. We determined that the endoscopes manufacturers, as well as the federal government's recommended guidelines for processing these scopes, are inadequate. So once again, there you go, Doc. I mean, and this has been an existing problem since at least 2012, and nothing's been done about it. Where's the FDA on this one? If this was some sort of alternative health thing that was killing people and infecting people, it had already been pulled off the market.
Exactly. You have to appreciate, Doug, and I know you know this because we've been working together for a long time, everything the FDA approves, one of the major side effects is death. There's not a single thing that the FDA approved that doesn't have a side effect of death. And I find that kind of interesting, that they still will approve things that they know one of the side effects can be death. And so I find it kind of interesting. And, of course, this is why I want people to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to do all their own laboratory work. You can do the equivalent of a colonoscopic exam for like $2. You can get a series of test strips called the occult blood test to determine if you have any blood in your bowel movement. If you do, you can go get without prescription, you go to a radiology laboratory and get a high-resolution ultrasound, no radiology there, no radiation, okay? You can see if there's anything going on without any invasion. You don't have to have somebody stick a garden hose up your rump and puncture intestines like you did Andy Rooney and kill him. And then you can take your own blood test. You can take your own urine test. Test strips cost you $1.50 each. You can do a physical that a doctor will charge you $2,000 in his office and use the same test strips he's using, which you can get without a prescription from a pharmacy. Get all the values and numbers by doing these tests and check them against the charts in Let's Play Doctor in the home laboratory section, and you'll get more information. It'll be safer, no risk of death by doing it all yourself. Okay, and I urge everybody to do that. That's the book, Let's Play Doctor, in the home laboratory section. Before you go to a doctor and let him run tests on you and kill you, do it yourself. We're kind of the Home Depot of health here. Thank you so much, Doug, for bringing that one up. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Independence, Missouri. And Doug, you're on with Dr. Wallach.
Hello, Doug. You're on the air.
Hey, thanks for helping so many people change their lives. Hey, I met a man just briefly here for about 20 minutes. We talked. He had to go to work, but the doctors want to take out his gallbladder. And if you're really having issues, he's been on a reflux inhibitor for years, and it hurts him so bad when he eats. His stomach hurts.
Sure. Let me ask you, how well do you know this guy?
Not very well. I have a friend that's a friend of
you want to ask him if he has a history of, like, skin problems, asthma, those kind of things, because the odds are he's got a gluten intolerance. Okay? Yeah. So what I'd do is I'd get him going on a gluten-free diet, get him on... What supplements would you give this guy, Shar?
For a gluten-free diet, I would, if he doesn't have anything else, I would just give him a healthy starter pack.
Okay, healthy starter pack, and he's got a gallbladder problem. He's got gallbladder pain.
Yeah, he needs all the enzymes.
Ultimate enzymes, right? We call it the gallbladder in a bottle. Exactly right. Get an A+ there. So I'd give him 2 of those ultimate enzymes, 2 minutes before each meal, with a couple ounces of water. Put him on a gluten-free diet, and as Shar says, get him on 1 healthy start pack per 100 pounds of body weight. And wouldn't hurt to also maybe throw in the probiotics, something like the root beer belly, and give us a call. I'd give it a month. Obviously, this has been going on for a long time, so another month's not going to make any difference from the standpoint of do the surgery now kind of thing. But I'm sure they've done CAT scans, they've done ultrasounds, and they don't see a malignancy, but his gallbladder area hurts. They'll take his gallbladder out. If it hurts down in his groin, they'll take his appendix out. But, he's a type 2 diabetic, too. Well, there you go. Char, what would you throw in? In addition, what would you add since he's a type 2 diabetic?
The sweeties.
Very good. The sweeties. Have him take 3 of those twice a day per 100 pounds of body weight. Check his fasting blood sugar every morning before he medicates himself. Adjust his medication as his doctor has instructed him. His blood sugar goes down, less medication. Blood sugar goes up, more medication. And this should be pretty straightforward. Okay? And let's see here. Give us a call in a couple of weeks. Let us know how this guy's doing, because he should turn around pretty quick and have a, when you get rid of the offending factors here, which is the gluten, and you need to let him listen to that CD called Serial Killers. Goes into a lot of the various symptoms and things and problems that doctors will diagnose as something else, but the basic underlying cause is gluten intolerance, and certainly gallbladder pain, appendicitis, diverticulitis, celiac disease, irritable bowel syndrome, inflammatory bowel disease, colitis, ulcerative colitis, Crohn's disease are all due to a gluten intolerance.
Let's head to Oklahoma, and Renee, you're on with Dr. Wallach.
Renee, you're on the air.
Yes, my 2-year-old daughter is TP independent, fed through a Broviac, and she is autoimmune. They're still trying to figure out exactly what is causing it all, but she has multiple steroids, face swelling due to them, and other high-powered medications, and she's throwing up and still loose, watery stool.
Okay. Now, did you breastfeed her?
I started out, yes.
Okay, now, did you have asthma as a kid?
No.
Did you have any skin problems as a kid? Eczema, dermatitis, psoriasis, rosacea?
No.
Okay, did you ever have any bowel problems yourself? Diarrhea, constipation, bloating, reflux, anything?
Not until I had my gallbladder removed, and then I still had the diarrhea, but no.
Why'd you have your gallbladder removed?
Because they said it was badly infected.
Oh, you said diarrhea. How long did you have the diarrhea before you had your gallbladder removed?
I didn't have the diarrhea before I had the gallbladder removed. I had the diarrhea after.
So you had pain on the right side?
I had pain in the middle of my chest, like I was having a heart attack.
Yeah. Okay. Do you have any other children? Is this your only child?
I have a 4-year-old as well.
Okay. That child have any problems?
No, she's perfect.
Good. You have any brothers and sisters?
I know.
Okay, so you're an only child.
Yes.
Okay, does your mama have any health problems?
My mom has psoriasis.
Okay, enough. Okay, Char, what's the problem?
It's gluten intolerance, no question about it.
Yep, mama has psoriasis, passed it on to you, Renee. You passed it on to your child. And there may be other things going on. There may be some inborn errors in metabolism here, but basically this child has gluten intolerance. So if you get everybody in the household gluten-free, okay, including the dog and the cat and the bird and the fish, spouse, grandma, mother-in-law, everybody in the household has got to be drop-dead gluten-free. Get a hold of that CD, Serial Killers, and learn all the hidden places you're going to find gluten. You know, stuff like meatloaf and gravies and soups, and it's in ice cream and yogurt. They use it, machinery that packages nuts. On the front it will say, these nuts are naturally gluten-free, and then you roll it in the back in the allergen section that these nuts are packaged on equipment that also packages wheat. So the dust in the bag is wheat dust. It's everywhere, okay? And so, yeah, that's the basic problem. But you and your mom, if she's still alive, your other child needs to have the 90 essential nutrients appropriate for their body weight, okay? And the child, the little 2-year-old, can take the something like Tropical Plus and the EFAs. I would just start with something simple like Tropical Plus and EFAs. And then she can graduate to other things once you get her stabilized. But everybody in the household, I mean, this is, these doctors are spending a lot of time, money. They're torturing that poor child. And there is no such thing as an autoimmune disease except when babies are born bubble babies kind of stuff where the mother's missing stuff and didn't make the immune system inside the child because she was missing things when the immune system was being formed. And so this is basically, as Shar said, started with your great-great-great-great-grandma on your mom's side, passing it all down through the females. It's not a genetic thing, but it is passed on through cord blood and breast milk. And it's something that everybody's going to have to be gluten-free forever. Otherwise, everybody's going to be miserable forever, and their forever is going to be shortened because they won't live very long. We'll be back after these messages.
All right, let's head to California. And Lisa, you're on with Dr. Wallach.
Hello, Lisa, you're on the air.
Yes, how are you?
Okay, I have to speak up just a little bit, please.
Okay.
That's better. How can I help you?
I was diagnosed with myasthenia gravis. It's an autoimmune disease.
Okay, how old are you?
Excuse me?
How old are you? What is your age?
I'm 60.
Okay, and how much do you weigh?
84 pounds.
84 pounds, okay. How tall are you?
I'm 5 feet.
Okay, so you're slim. All right, do you have any other issues? Do you have any skin problems, eczema, dermatitis, psoriasis, any asthma, bronchitis?
When I was young, I had eczema. That's about it.
Okay. Shar, what's our basic problem here?
But she's got a gluten problem.
Yep. And myasthenia gravis is kind of a cousin to fibromyalgia, to lupus. It's not autoimmune in any way, shape, or form. It is multiple nutritional deficiencies. And, of course, in your case, it's caused by malabsorption because you have a gluten intolerance going back to, when you were conceived, all through the pregnancy you were developed in. And do you have any children yourself?
Yes, I do.
Mm-hmm. How many kids you got? How many children do you have?
3.
All right. Do they have any health problems?
No.
I don't know. You're telling me that with 3 kids, none of them have constipation or diarrhea, none of them have dry skin, none of them have allergies or cough, none of them have a weight problem?
Well, I raised them on vegan, basically vegan.
Uh-huh. Okay. Well, I guarantee you they got problems, so we need to talk to them. But what would you do for this lady, Shar? She's got muscle problems. She's obviously lost muscle mass. She's got muscle weakness and kind of, again, like fibromyalgia. What would you do for her, 84 pounds?
I would get her on the healthy brain and heart pack because the muscle, there's copper in the selenium. The copper will help her.
Mm-hmm. Okay, both the selenium and the copper be very, very good for her muscles and connective tissue.
And then I'd get her on the glucogel for that.
Okay, very good. Well, 84 pounds, I'd have her take 1 healthy brain and heart pack per month. I'd have her get an extra bottle of selenium so she could have 3 of those twice a day, or 2-3 times a day for a total of 6 a day. And as you point out, she needs the, I'd get her one bottle of, large bottle of glucogel so she could have 3 or 4 of those twice a day. The glucogel capsules to support and promote maintenance and repair cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. I'd also throw in the D-stress capsules, capital D like David, dash stress, for the raw materials for brain metabolism, nerve metabolism, muscle metabolism, and certainly got to be drop-dead gluten-free. Everybody's got to be drop-dead gluten-free. No fried foods, no processed meats, no oils, no gluten, no wheat, barley, rye, and oats in any way, shape, or form. And then give us a call every couple of weeks, Lisa, and check with your kids. And when you call us, let us know what kind of health problems your kids have, because I guarantee you they got some health problems. But this should help you immensely, being on a gluten-free diet and supplementing properly. So do call us every couple of weeks, bring us up to date, and we'll walk you through this. Okay, Doug, let's go to callers.
Well, let's stay in California and head to Torrance. And Elizabeth, you're on with Dr. Wallach.
Elizabeth, you're on the air.
Hi, Dr. Wallach. We have a white Maltese dog, and she comes in from outside and starts licking her paws until the fur turns brown.
Mm-hmm.
And we've tried different kinds of diets for her and different foods, and she's still having the same problem.
Okay, sure.
Yeah.
Okay. Does this dog scratch itself? Does it lick any place else, or just in between the toes?
Just the paws.
Okay. And does it have constipation or diarrhea, or does it have a cough or anything like that?
Doesn't seem to.
Okay. Very good. What does the dog weigh?
Oh, dear. I don't know that.
Is it big as a cat?
She's not
twice as big as a cat? No, that doesn't answer the question. Is she twice as big as a cat, the same size as a cat, smaller than a cat?
About the same size as a large cat, yeah.
Okay, so maybe 8 to 10 pounds. Okay.
Yeah.
All right. So, Char, what would you give this dog?
I would give it Arthrodex, but I'd also give it essential fatty acids.
Okay, very good. Exactly. I'd go ahead, say, at the 8 to 10 pounds, I'd give that dog a half a scoop of Arthrodex, which is our multiple for dogs and cats. Put that in the food. And as Char said, I'd go ahead and give that dog 2 of the EFA pluses a day also. You can either puncture the EFA pluses and squeeze the oil in the food, or just throw them down the dog's throat and rub his throat and let him swallow it. But also, I'd make sure that you have a grain-free diet, because this is usually the result of a gluten problem. They get itchy skin, and so I would definitely get this dog on a grain-free diet. Absolutely no wheat, barley, rye, or oats in the dog food. And some of these dry dog foods, the first ingredient is wheat. Okay, that's what makes them crunchy, and the dogs like to crunch, but they can't tolerate it. And dogs get gluten intolerance too. Cats get gluten intolerance, and they will lick hot spots all over themselves. Sometimes the hot spots are in between their toes. So got to be gluten-free. Everybody in the household's got to be gluten-free, including the kids and grandma and mom and dad and bird and fish and cat. Everybody's got to be gluten-free in the house. And then, of course, you can use our CM cream and put the CM cream in between the toes, or the CM Plus capsules. You could go ahead and give that dog 2 of those a day, 1 in the morning, 1 in the evening, the CM Plus capsules, and that will give some relief, global anti-inflammatory relief. But you got to change the diet and get them on the Arthrodex and the EFAs, as Char said. Okay, Doug, let's go to callers.
All right, let's head to Florida. And Ed, you're on with Dr. Wallach.
Well, Ed, you're on the air.
Yes, sir. I've been on the Healthy Body Pack, gluten-free. I'm taking 9 selenium a day, Ultra Daily. I've upped that to 12. Extra bottle of calcium, which is Calpati. Taking 4 ounces of that a day.
Mm-hmm.
And I've been on Prost FX for about a month.
Okay.
I've been on high blood pressure since I was 26. I am 63 now. I've had a total of about 3 years in my whole life of not being on blood pressure medication.
Mm-hmm.
About the time I started this regimen, I was on them about a week, and I went in the hospital. They said I had congestive heart failure.
Okay. All right. Are you on medication for congestive heart failure now?
No, I am taking 2 different blood pressure meds.
Okay, well, hang on. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go right back to Florida. And Ed, how much do you weigh, Ed?
150.
150, okay. All right. Well, I'm going to go ahead and take this one, and so we have time for another one. This is pretty straightforward. Make sure you're staying away from all the bad stuff, okay? And you're probably on that, but just for the audience here, absolutely no fried foods, no processed meats with nitrates, no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, all that kind of stuff. Absolutely no oils, no olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils, and then absolutely no gluten, no wheat, barley, rye, and oats. You're taking most of the stuff you need to take. Just remember, because 150 pounds, and high blood pressure off and on, I'd like to see you take 9 of the Ultimate Daily tablets today, 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 2 bottles a month of the Ultimate Daily tablets. And they're designed to support and promote healthy blood pressure, support healthy blood flow through obstructed arteries. The fact that you have congestive heart failure, I would also throw into everything else you're taking, not a replacement, but an add-on specifically to support healthy heart function and metabolism is the D-stress capsules, capital D like David, -stress. I want you to take 3 of those twice a day. That'll be 2 bottles a month. And congestive heart failure is almost always a deficiency of a single vitamin. And so I want you to take 3 of those D-stress capsules twice a day, 2 bottles a month, and then call us every couple of weeks. We want to know your blood pressure. We want to know your weight because you're going to lose some weight if you have congestive heart failure. You tend to collect a little bit of fluid here and there, some edema, so you might get down to 143 or something like that. And so we'll kind of keep track of that. Give us a call every couple of weeks, but keep on everything else. Don't forget to get off of gluten. Okay, Doug, how much time we got here?
We got time to go to another one. Let's head to Alaska. And Bill, you're on with Dr. Wallach.
Okay, Bill, you're on the air.
Hello, Dr. Wallach.
Yes, sir. How can we help you?
I live in a nursing home.
Okay. And what's your health problem?
Well, I have MS.
Okay. All right. Well, let me answer the question for that. MS, and this same thing will be true for MS, Lou Gehrig's disease, ALS, and also Parkinson's disease. Number 1, Shar, how many eggs does somebody need to take per 100 pounds of body weight?
About 6 to 10.
Very good, very good. That's perfect.
Anyway.
Yeah, 6 to 10 is fine. Okay, Bill, how much do you weigh, sir?
150.
150, okay. So at 150, I kind of dose you for 200 pounds, and so I'd go ahead and take 12 to 18 eggs a day. They can be soft scrambled in butter, not margarine or oils, soft poached with soft yolk, soft boiled with soft yolk, because you got to rebuild the brain, and then we got to get rid of some of those lesions in the brain. You got to help the immune system get rid of those lesions in the brain that are associated with MS. And you can have all 3 diseases, but there's more symptoms of MS, plus they can see them on the CAT scan, so they're going to diagnose you with MS. But definitely, what basic program would you give somebody with MS, Shar?
The Healthy Brain and Heart Pack.
Perfect, A++. So here we are, 150 pounds. I go ahead and dose him for 200 pounds. Bill, I'd give you 2 of the Healthy Brain and Heart Packs per month. That'll be 3 of the selenium at breakfast and dinner. It's going to support the immune system. 1 ounce of the Osteoex Plus at breakfast and dinner. 2 scoops of the Beyond Tangerine 2.0 Nutri-Crystals at breakfast and dinner. 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All that will be accomplished by the 2 Healthy Brain and Heart Packs per month. But it's imperative, again, that you also take the D-stress capsules, capital D like David -stress. Take 3 of those twice a day, 2 bottles a month for the metabolism of the brain. And don't forget the dietary restrictions, and don't forget the, say, 12 to 18 eggs a day. And that's designed to help support maintenance repair of the myelin, the white matter of the brain, which is damaged when you have MS, is damaged when you have Lou Gehrig's disease, and damaged when you have Parkinson's disease. And so give us a call every couple of weeks. And if you can't find somebody in the nursing home to do it, you may have to have one of your relatives come in and bring in one of those grills and electric pans and everything and help you out with some of that stuff. But the supplements, they should be able to help you along with that. Give us a call every couple of weeks. Well, thank you, Shar. Super job. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.